Today we have a new group joining us today from the August session, as well as previous one are from the June session. Okay, so the people who are from June, this will be a sort of revision oblique repetitive session for you people, wherein all the images will again be going through in front of your mind. So bear with me for another 30-35 minutes and let me know if boredom or stress takes over you. So I'll start presenting my screen. So guys, first of all, this is for the people like whom we are interacting for the first time today. For the next 1 month, approx 3, 4, 5 weeks, whatever the day which are available to us for the practicals, we keep on interacting, keep on pushing you guys so that things remain in place. One. Number two is that will like sort of orientation towards the practicals of DNB, because DNB itself is a nightmare, and the practicals per se are also, I'll say, like the exact pattern, everything is not clear to us, so therefore it's very confusing to us. Okay, so a short orientation to you for the DNB practicals. One thing is that you have to break it down so that you can go sail through it easily, because I have interacted with approximate a good number of students, and there is a lot of confusion prevailing among them. Okay, so the first thing is like 2-3 things you should remember. The OSCEs which are there, you'll be having around 20 OSCEs. Okay, and 5 marks each, resulting to total of 100 marks. Now the important point is not 20, important point is this thing. Okay, are you able to see? Important point is 4 minutes each, because as soon as the OSCE is flashed in front of your screen, the stopwatch starts running. Okay, so as soon as the OSCE is flashed in front of your screen, the stopwatch starts running backward from 3 minutes 59 seconds. Now that is the place where the whole game changes. The stress takes over your mind, and here we are bound to make silly mistakes. Number two, we are bound to commit mistakes which we will not do in a normal setting. Okay, so these all brainstorming session and practice session will be to make you simulating the same experience, and that your mind should work accordingly. What all questions can be asked, how to answer about them, and supposedly all those things. Okay, one is this. Second is your case discussion. That will approximate. These all things depend upon case to case, hospital to hospital, institution to institution variation. Generally, it's divided into 100 marks for the long case, and the remaining 100 they can give short case. They can give multiple board rounds or multiple table viva. It's like they can keep a table for otology, they can keep a table for head and neck, they can keep a table for recent advanced, and divide the marks accordingly. So these things like case discussion and board rounds, table viva, we'll be discussing separately. The major chunk goes for the OSCE, because these are the things which are not touched upon in the institution, and the resident is supposedly pending for himself or herself solely alone. Okay, so basically out of the 20 OSCEs, don't get scared. It's like if you divide it, 10 OSCEs are the routine stuff. Okay, so if you have read your book, if you have read your note all the 3 years, then you will go for it easily. There's no doubt about it. सब आपको आता होगा. 5 questions will be like, there will be a moderate level of difficulty, and it will require a certain level of expertise and hard work to be put from your end in order to clear it completely. And then there are 5 bouncers. Okay, why I call them bouncers? It's like nobody knows what kind of questions they might ask. Okay, last year they asked a question. They gave a CT scan image, HRCT temporal bone image, and they were asking what is the formula for calculating the cochlear duct length. Okay, one. Number two, calculate the cochlear duct length in the given CT scan. Okay, so they had given something, but these all questions can be like, you might know it, you might not know it, or like it can be completely ignorant. कुछ नहीं पता होगा. So these 5, don't worry, nothing to worry about that. Our main motto should be to cross the 50% marks comfortably. It should not be 50-51 category. Comfortably pass on that. That is the motto. Okay. So let's start with today's session. So let's start with all this background knowledge. we'll starting with the today's session. Please keep on pinging me up for any doubt of yours, any stupid, any serious doubts. Okay. Second thing is, I will request to like people who have joined us for the first time. This is not like we don't keep it a boring type of PPT session, है ना? I keep on changing the PPT. Okay, खत्म हो गया. You also go back and sleep. I also go back and sleep. That is a stupid nonsense kind of thing. Like, and second thing is, I believe that if we keep on interacting now, so that is always better for your side also and from my side also. And nobody knows each other. Second good point is this. So even if you make any mistake, there's nothing to be कि मतलब मेरा गलत हो गया. No. So it's better to make mistake over here rather than making mistake on your final practical day. Okay. So with this, let's start. Okay. So this image is a quite popular image. So see the image given below and answer the following question. The first one is, what is fluence threshold? What are the uses of laser in ENT? And what is laser safety? It's not laser safety, it's laser safety. It is auto-correct even by my good notes. You can write it like this. Not laser safety, it is laser safety. Okay, so I'll keep on answering, and I'll request you guys also to drop in between, give right answers, give wrong answers, so whatever you feel like, but keep on uttering something so that your brain keeps on ticking. Okay, the first thing is, what is fluence threshold? That has been asked previously also. So basically, what is fluence threshold? That is your measurement of lowest energy level at which tissues begin to vaporize. Tissues begin to vaporize. Okay, so this you have to ratify it, learn it. Now, what is laser safety? Laser safety, we all know that like we follow in our institutions also. Secondly, Scott Brown also, they have mentioned a whole paragraph about the laser safety. The first thing being that in the room where the surgery is being performed, there should be a big board of laser is on outside the OT. The lights should be dim. The people should be wearing the safety glasses. Okay, the endotracheal tube that should be covered by a wet gauze piece. Third, laser safety tube should be used, and the fire extinguisher should be in place. All those type of things that are attached in the PDF. Now, last thing is name 2 uses of lasers in ENT. Now, who will break the silence and give me 2 uses of lasers in ENT?
Epidotomy.
Okay. So I'm really sorry, my earphones attached नहीं था. Just a minute, please. From that, anything else?
It can be broken down into otology, rhinology, and laryngology.
Exactly. I was waiting for this answer. Just imagine that this is the same thing which is asked to you in the Viva. Okay? What are the use of lasers in ENT? So a humble request will be to break it down into subparts. Otology, 2 uses. If you remember any use in nose, 2 uses. In head and neck, 2 uses. So that will be like first thing is you will have a good impression on the examiner, one, and your exam answer will also be better organized. Okay, but here they have just asked 2 uses of laser in ENT, so we can go with the steroidotomy, we can go with like excision of the benign lesions, we can go with the Kashima's procedure. Okay, posterior cordectomy, all those things we can include. Okay, now how this laser thing can be asked extra. Okay, one is this image. Now, who will answer? Who is this gentleman? And why is he important? Like होगा कोई भी होगा, but अपने लिए क्यों important है? It can be asked in exam, but why is he important?
Sir, Kumar, I think.
हाँ, he is Kumar, but Kumar के आगे और Kumar के पीछे भी कुछ है.
Kumar.
C. Kumar and Patel. So Patel से we came to know that he is an Indian. ठीक है? And why is he important? Because he is associated with invention of your CO2 laser. ठीक है? There are only few places where name of Indians are on a highest priority, highest setup. So Dr. Kumar and Patel, he is associated with this CO2 laser. Second question over here only I would like to associate. You would have all read Scott Brown, the chapter of hypopharynx carcinoma. उसमें डॉक्टर हरिकेश पै सर का नाम आता है, ठीक है? तो हरिकेश पै सर is like a prominent otorhinolaryngologist whose like cases these things are included in the Scott Brown. Therefore, this thing becomes very important for Viva. Okay? चलो अगला second question is पहचान लिया आपने? What is the wavelength of CO2 laser? Can I have answer from somebody?
10,600
आगे, this is very important. Nanometer. Okay, because this is the place where you will make mistake under the confusion. If you write something else, answer goes wrong, you will not get that 1 mark. Okay. Now again, this is the laser safety tube. Okay, this is the laser safety ET tube. Now what is the important thing over here? Can you see there are 2 bulbs over here? Okay, so these are basically to prevent the accidental fire hazard basically which used to take place in the previous session tubes. Apart from that, like it is suggested that air should not be inflated in these ET tubes when we are using laser. Okay, so this is the theory which was associated with it. What are the laser safety principles of laser safety? You have thing, and what all things are supposed to be answered in Viva. Point wise Scott Brown ka table hai that I've kept it over here. Okay. One more question which can be associated. See, these are the 2 laser safety tube by the name. One is the Norton's tube. This is your Mallinckrodt's tube. So just see this tube. This tube itself can be asked as a OSCE based question. See, what is this tube? Identify where all you will be using it. Okay. ठीक है? So these tubes itself can also be asked as a like separate OSCE. ठीक है? Now one more question from the tube which can be asked is this thing, like a routine ET tube which is they have given, and they can ask you what is this thing. Okay, so this is basically Murphy's eye. Okay, used for ventilation purpose के लिए this can be used. One, and apart from that there is a radio opaque line which is there over here. Okay, I don't know whether it's clearly visible to you or not. So these 2 questions are also associated with ET tubes and laser safety protocol. One more question which image I was not able to incorporate in today's session, that will be your nerve monitoring tube. Okay, I'll send it to you along with the PDF. Like in our RLN monitoring which we use, उसमें जो ET tube which you use, that is also a potential OSCE question. So covering all these things, like questions from your lasers and the endotracheal tubes will be over. Okay, coming to the next thing. This has been asked I think 2-3 number of times. Okay, most of you would be knowing this answer. Okay, I'll bring your attention towards this thing. ठीक है? Are you able to see this thing? This is important because ये है जहाँ से pressure build up होगा. यहाँ से the pressure will start mounting in your head as soon as it is ticking backwards. Okay, so that's why you have to keep on practicing things so that on the penultimate day you don't falter on the small issues. Okay, so I'll start backwards. What is the C number? This has been asked as an individual question also, individual OSCE and in a group OSCE also. C, everybody is clear? What is C? स्कीटर. ठीक है, तो C को तो पहले ही लिख दिया स्कीटर, तो दिस इज इजी. नाउ A is perforator and B is your Larkin's hand burr. So if a person who has not practiced this OSCE at all, ठीक है, I'm talking of that one guy, backbencher guy, जिसने कभी नहीं पढ़ा. So what is he supposed to answer in this? First question, he should answer skeeter at least. He should answer perforator at least. Larkin's hand burr, I understand that this might go wrong. Okay. Now second question is again easy. Name the surgical procedure where they are used. So one answer everybody can say. सब बोलेंगे ना, स्टेपोडोटमी के लिए यूज कर सकते हैं. Okay. Now third question again easy. Mention the no contact tool for performing this procedure. Dr. Sonali, can you answer for this thing? Dr. Sonali is not there. She's there. बोलो.
No ideas.
अभी इसके पहले कौन सा पढ़ा हम लोगों ने? लेजर. ठीक है, तो ये हो गया लेजर. तो विल बी आंसरिंग ओवर लेजर ओवर हियर. ठीक है, so that's what I'm saying कि your mind should keep on running, keep on integrating things. Integration is very important. You have read it already. You all have read it already. The main thing is कि उसको OSCE में apply करना है अपने को. ठीक है, तो the no contact tool for performing this procedure is your laser. Okay, CO2 laser generally very commonly used is CO2 laser. Now coming to this thing, enumerate 4 intraoperative complications of the procedure. Now, supposedly, if it is asked in Viva, can name some complications of this stapes surgery. So always, so always break it down. Like what can be, yeah, exactly. Intraoperative क्या हो सकता है, postoperative क्या हो सकता है, immediate post-op क्या हो सकता है, ठीक है? So how we can go about it? Like what kind of, you all know the answers. Okay, I'm just taking your mind towards that. They are asking for, so 1, 2, 3, 4 अपने को लिखना है. So what all can go from the right, from tearing of the tympanomeatal flap, it can result in a perforation in the TM, it can permanently your ossicles can get damaged. Then floating foot plates can be there. Like the important ones are these. Floating foot plate हो गया आपका, CSF gusher हो गया. So all these things are, yeah, exactly. Okay. Now over here, ये 4 तो clear हो गए. 2-3 questions are extra which can be asked. Are your CSF gusher? ठीक है? They'll ask you how will you manage a CSF gusher? 1. Number 2, what they can ask you? What are the indication or yeah, what are things here you can have to avoid the surgery? So this is basically very what I'll say, it depends upon case to case variation, upon the experience of individual to individual. Some people like overhanging facial nerve also, like likes of great surgeons, they like to go ahead. Some people say that if facial nerve is overhanging, you can abort it. Okay, apart from that, okay, all the instruments used for stapes surgery. Sex is for surgery, okay? So it is important. So please go through all these extra things along with the and fourth will come with fourth one will be the pistons which you can use. Okay? So in the PDF for pistons and all artificial things, जिसमें TEP, GROME ये सब discuss करेंगे. So there will be 2, 3, 4 pistons which will be specifically used for stapes surgery. तो वो नाम अपने को पता होने चाहिए, वो images अपने को याद होना चाहिए. Okay? तो इसके बाद let's go ahead. This is a simple part. Check the diagram and answer the questions that follow. What is part 1, 2, 3 and 4? Okay. So let me answer something for you guys. 1 will be your these is phalanges. 2 is basically your cuff. Okay. 3 is your pilot balloon. Okay. 4th is your obturator. Okay. Exactly. Now, what is the protocol which is used for decannulation? Dr. Aparna, can you take it a try? What is the name of the protocol?
Great Ormond.
Great Ormond. Again? Great.
Street.
Oh, yeah, he was living on a street. Okay, still he was great. And this was the protocol, something he followed. Okay, Great Ormond Street protocol. Okay, now third question is, I'll share the PDF of Great Ormond Street protocol. Like if you don't have, your new group won't be having it. I'll share it again. Why is tracheostomy in pediatric patient difficult? Answer remains simple. You have to answer it in point wise. That basically there is a large head to body ratio. There is prominent occipital protuberance, so making it difficult for the tracheostomy yoga. बाकी तो वो आसान, like you know that that tissues are very soft. ये थोड़ी difficult to identify trachea. Lumen बहुत छोटा होता है. वो these are routine answers. Now over here only 2-3 things again which you have to note. What is the difference between adult versus pediatric temporal bone, adult versus pediatric mandible, adult versus pediatric larynx? ठीक है, जिसमें this is your most important mandible वाला. ठीक है, क्योंकि उसमें exactly they have 2-3 specific points, the location of mental foramen, the like condyle और उसके आगे का जो which is higher, and what is the angle of mandible in these things. We'll discuss these things and we'll be discussing osteology. जब mandible revise करेंगे, we'll discuss all these things. So this question should come into your mind कि हाँ ऐसा कुछ पढ़ा था हमने. So this page goes blank. Okay. This is a very important drug. The name is bevacizumab. What is the mechanism of action? Can I have the answer, Dr. Akash?
VEGF inhibitor.
Exactly.
Growth factor inhibitor.
See, one more 2-3 3 points पुराने वाले लोग को याद रहेगा. आप सब जो people who have joined us new, please stop using short forms until you pass your OSCE DNB practicals. No short forms to be used. Everywhere जहाँ भी आपको full form याद आ रहा है, you have to use full forms. 2. Second question. Whenever there is a drug given in front of you, please see the date of expiry. There have been instances. I'll keep on repeating this thing because it should go into your head. It has been done before by DNB. कि मतलब image दिया हुआ है. It is date of expiry is given, which has been passed, and drug is out of expiry. And it is कि how will you give this drug to the patient? So answer should be that this drug cannot be given to the patient. Third thing which you have to keep in mind, whenever you are examining a patient, please, one is wish the patient. Second is introduce yourself that I am Dr. So and so. Today is my exam. I want to examine you for these things. Third, take his consent कि भैया मैं आपको examine कर रहा हूँ. I will examine your thyroid. 3, 4, show him, explain it to him. What is the procedure? How will you explain? 6th is after everything goes okay, you have to say thank you to the patient. These things will be watched by the examiner and you will be marked accordingly. So I'll share you my experience when we were in first year. So we got a danda from our seniors कि हर patient को wish करना है इस तरीके से, so that it came into our muscle memory. But like it's not the norm. We don't practice it in the government setup or in the corporate setup. But for exam purpose, please follow it. Previously also, there were like counseling stations which were asked, like supposedly they used to give you a specimen something and they'll ask you in OSCE also and in Viva also that counsel the patient for total laryngectomy. So how will you go about these things? First is again same kahani, wish the patient, explain the diagnosis, what is the treatment, what all options are there apart from treatment, what you are counseling. ऐसा नहीं है कि इसको तुम बोलो कि total laryngectomy है, apart from this nothing is available for you. So what all options can be there? You have to counsel the patient with all the advantage and the disadvantage, and after everything is over say thank you. Okay, so we all go ahead with this thing. Apart from bevacizumab, one more drug which will be very important to you will be cetuximab. Okay, so drug section में we'll keep on revising. Make your list of things. I'll share with you what are the around 8 to 10 breakdowns you have to do. Scientists, syndromes, HPE, osteology, drugs, that is pharmacology spotters, radiology spotters. So this all we can break down in around 8 to 10 headings, and उसके अंदर में we can keep on pushing data and keep on revising it. Okay. Now coming to this question, I have just included the same image which came in the DNB. So all of you know the answer. What is the most likely diagnosis? Everybody can see this thing. ठीक है? So it will be some CP angle tumor. The answer most probably is. What is the answer? Vestibular schwannoma. Exactly. What is the sign seen on the MRI scan? Can somebody again give me answer? बोलो क्या?
Ice cream cone appearance.
Ice cream cone appearance. Exactly. Ice cream cone appearance. ठीक है? Now what is the contrast using this scan? Answer is gadolinium 32. ठीक है? Okay. Now this thing I will fourth वाले को I'll like to elaborate a bit. So let's go ahead. See, that's why I say Scott Brown is very important for you. The same image is given in your Scott Brown. Just see this image, and this I have taken from Scott Brown. I have even mentioned the figure number, so you can go and check. The answer remains the same. Okay. Now, why is this curve important? ठीक है? There are two named curves in your ENT setup. One is your Nelson-Allen curve for the growth of your vestibular schwannoma. So please remember this curve. Apart from that, this thing also, there is one more named curve which is there in your biostats. People will be remembering it. Answer is Kaplan-Meier. This is not Kaplan-Meier. Don't get confused. We'll revise it when we will be doing our biostat section. This is another question. Identify what is image को identify करना है. They'll ask you what is hazard ratio and what is the advantage of using a Kaplan square. Over here, just remember these two names. यहाँ vestibular schwannoma में Nelson-Allen curve है. See this image. आप जब आपने पढ़ा होगा Scott Brown, you would have read it around 10-15 times by now. But this name generally skips our mind. But this is a potential question which can be asked. So please remember the name. Let's go ahead. what is the difference between SRS and SRT? Okay, this has been asked. Okay, SRS and SRT. In SRT, what happens? Ki like multiple settings of treatments are required, whereas in SRS there is a single setting of treatment which is being given to the patient. So this is the one difference which exactly you should answer as given in your Scott Brown. Okay. So what is the difference between cyber knife and gamma knife? Your SRS is divided commonly into two parts, that is your cyber knife and your gamma knife. Okay, so how to divide it? In gamma knife, there is a rigid framework which is required. Over here, there is no need of fixing the rigid framework. Okay, how I learned it, like I had like a lot of confusion. मैं हमेशा बोलता था कि rigid framework किस में होता है. So I remembered it by this thing. Cyber has something related with the computer and the laptops. So laptop cannot be fixed. Okay, so that's why it is not fixed. It means there is no need of any fixing anything. Gamma पुराना हो गया, so therefore rigid framework was being used. So this is the main thing which you should remember. Apart from that, there are multiple other things that this thing your gamma knife is, since it is older, so only intracranial में use करते हैं. Cyber knife is used in intracranial and spinal tumors as well. Now coming to this thing, what is RION? People, you would have gone through this thing. Who will give it answer? Yeah, you are able to see my screen now. Hello? You are able to see the screen, right? Okay. I thought there's something wrong with it. Okay. So RION is basically your
radiation-induced optic neuropathy.
Exactly. Radiation-induced optic neuropathy. One more thing. Every year they are asking one acronym for sure. They will ask you expand this thing and give some use of it. So RION is a potential question. Okay. So this is generally seen when your exposure is more than 8 grays. Okay. This is data is taken from Scott Brown itself. Now apart from this, two more questions and answers will be there. SRS आप use कब करते हैं? They'll keep on asking what if it ये जैसे ये question पूछा था इन्होंने कि what will be the complication? ये हो गया in tumors greater than 3. So they have given the answer of one question that when will we use SRS. Okay, so SRS is generally used when the tumors are less than 3 centimeter in diameter. Okay, and what if the dose generally given in these things is your 12 से 16 gray की dose use करते हैं. So what is pseudo progression? Pseudo progression is basically after the treatment there is a transient increase in the swelling, increase in the size of the tumor followed by decrease in the size. So this is called as pseudo progression. Okay. Now again, these are all repetitive questions. Can you see this thing? Easy going. Bilateral vestibular schwannoma answer is NF2. Lovely, very good. Okay, NF2 is as important as vestibular schwannoma. Okay, so please revise both of these chapters from your Scott Brown at a single stretch. Pura like vestibular schwannoma along with the treatment, all the approaches which you have, SRS, SRT and NF2, all these goes in a single sitting. Okay, so NF2 is important. ये आपने देख लिया. What is the screening protocol? I'll include it. Screening protocol में we all know that screening starts at 10 years of age. Data is from Scott Brown, 8th edition, and you screen it by a MRI scan, and it is done regularly at a 2 years interval if the patient is under 20 years, and at 3 years interval if it is under 30 years. इस तरीके से याद कर सकते हैं 2 for 20, 3 for 30, starting at 10 years of age. So this is the screening protocol. ये हो गया. Treatment options में what are the treatment options? One drug which we saw just now, bevacizumab, it is being used for the treatment. Okay. So these two more images are there. They can be clubbed along with the CMRI findings, and you might be asked what is the diagnosis. Okay. So this is the Manchester's criteria for diagnosis or for diagnosing NF2. Please go through it. So let's go. This has been discussed before also. Please identify the device. Can somebody give it an answer? Answer is threaded tapered screw. and it is used for, now give the answer. Christmas, bolo, Christmas, ठीक है? Now see, now we have written the answer, we all know, see when I say we, it means myself and yourself, both of us together, ठीक है? It's very it will be very ignorant on my part, like if I'll say that, okay, read this, answer this, blah blah blah, that is ignorancy, okay? But I believe that I am also sitting on the other side of the table, I am also giving my exam, so how will I approach this question if I don't know anything about this answer? Suppose अगर आप आपके एग्जाम में ये क्वेश्चन आ गया, you are getting this question and you don't know anything about this answer, so try to find the answer in the subsequent questions, ठीक है? They are asking what are the grades of trismus, so might be if I'm 0% I don't know that what is the answer, there might be something related to trismus, so we can answer sir instrument for trismus or something like that, okay? Because negative marks तो है नहीं, so you don't have to read and leave anything blank, okay? You have to fill everything in your answer. Now, second piece of advice over here only. Whenever in the OSCE, you are likely to get a video-based question. You are likely to get a GIF-based question. So these questions will be having a small video, which will be of 15 to 25 seconds. और वो loop में play होता है. And it is a human tendency कि we tend to watch it twice. So आपने 2 बार देखा तो आपका 1 मिनट खत्म हो गया. So उसके नीचे जो 3, they would have asked 3 to 4 subsequent parts. So you will not be getting enough time to answer the 3rd and 4th part, which generally carries equal amount of marks. It won't be of any great importance that you show all the knowledge in the first question और 3rd और 4th खाली छोड़ दिया, उतना ही marks मिलेगा. So answer point to point and try to answer all the parts. Okay. So grades of trismus 2 तरीके से divide होता है. One is on the basis of distance, 30 to 40 mm है तो mild है, mouth opening. If it is 15 to 30 mm, this is moderate, and less than 15 है तो ये severe हो गया. Some people also divide it on the basis of inter-incisor distance. Some people divide it on the basis of the number of fingers which can go into the mouth. Okay, so these are the similar kind of images which can be given to you, and you can be answered similar things, or they can even ask you treatment of trismus or associated questions. Okay, so keeping pace with the time, this is again asked previously. Identify this device which is there in the baby's mouth. What is the name? अरे जून मानो, तुम तो बताओ. This is McGovern's nipple. For the August session people, it's okay. They were waiting for the result to come out and then start studying. The people who are studying from June, you shouldn't forget. This was the first image of last session. पहला image था ये. ठीक है? Don't forget McGovern's nipple. Okay? And where is it used? McGovern's nipple is used for choanal atresia. ठीक है? Choanal atresia में use करते हैं. This is of 3 types. This is bony, membranous and mixed. 3 प्रकार का होता है. ये हो गया. Another point about choanal atresia is that there is a cyclical cyanosis associated with this thing. What is cyclical cyanosis? That this is relieved on crying. मतलब उल्टा होता है. Normally we think that if the baby will cry, तो cyanosis worsen होना चाहिए. But in this, when he cries, so cyanosis is relieved. Now the next question which they are asking, name the condition or syndrome which is associated with it. The answer is Charge syndrome. Okay, Charge syndrome. So we should all know the full form of Charge syndrome. It is coloboma. It is heart defect, atresia of the choana. Yes, and R is for atresia of the choana, genital abnormality, growth retardation, and your ear abnormality. Okay, so हो गया McGovern's हो गया, choanal atresia हो गया. So see, you can see this CT scan also for the patient. ठीक है, यहाँ से if you go inside, so this is block. Okay, you go inside, block. So this is what is this? This is choanal atresia. They can give you similar kind of CT scan. They can give you, they can even give you like a running CT film also. Okay, and ask you these things. So choanal atresia हो गया आपका. Now second this thing. This is again a similar kind of question. This is pyriform aperture stenosis. Okay, so when you can see there is nothing over here. जैसे आप anterior से आप आगे जाएंगे, तो it is stenosed. Same goes over here. So this CT is also important for you. Now. Coming to this thing, again repeated question है. Please give the answer to me. Give it a try. अरे ये कुछ बड़ा सा दिख रहा है,
Mega incisor.
ओके मेगा इंसाइजर है ना. प्लीज कीप ऑन आंसरिंग, इट विल बी अ रिवीजन फॉर यू एंड फॉर एवरीबडी एल्स. डोंट थिंक दैट I'll like it's not cool to answer. Please keep on answering, please keep on answering till you pass your DNB practical exam. उसके बाद फैकल्टी बन जाओगे, फिर जो मर्जी चाहे करते रहना. ओके, दिस इज द CT of this. Please see this image of the incisor. Let's go ahead. It is where is it seen? It is seen in your pyriform aperture stenosis. Okay. It is a classical spotter. Sure. Over here, I'll answer. This is your Tarabichi stitch. Okay, it's a revision for you guys. And what are the advantages? Basically, it's used in your two-handed endoscopic surgery. Remember this image. And this was a gentleman, Dr. Moaf Tarabichi, who popularized this kind of thing. Now, coming to this suture, there is one more suture which is used. Identify this thing. What is the suture? Can you see over here? Let me show you. ये दिख रहा है, ये वाला. What is the suture?
Yes, a tracheal, laryngotracheal deconstruction में we use it.
Exactly.
Segment of sternal suture.
Sternal-mental suture. ठीक है. If there is any name for it, please let me know. I'm not sure whether very sure कि इसका कुछ अलग से कुछ नाम है. I've just mentioned it जो आंसर मुझे दिखा था क्वेश्चन में. ठीक है. हाँ?
Grillo suture जी.
Grillo suture. Exactly. Grillo suture. Okay. So this is generally used after surgeries like total laryngectomy, tracheal resection, so that patient should not extend his neck. Okay. So ये आपको पता हो गया. आगे चलते हैं. So guys, this is your image of contact endoscopy. This can be given to you as a video based question. I have taken the image which was given in Scott Brown itself. Okay, these images you can follow 2-3 books. Like what we will be going through in the next 1 month will be your Scott Brown, all the important images. Second will be your Lalwani, all the recent advances will be covered from that. And the head and neck wala part I have taken from Stellenmarin. Okay. So for contact endoscopy, 2 things you should be remembering. What is the magnification which they can give you, 60x or up to 150x magnification. These 2 numbers you have to appreciate. And what dye they are using. So name of dye they can be asked you. Methylene blue. Okay. So these 2 images you can you should know. Okay. Contact endoscopy का image हो गया. Now again coming to an image which has been asked previously. People you would have been knowing this thing. Let us go ahead with this. 45. Yeah, great. Dr. Irfan remembers this question very well. Guys, आपका जो otology section है, उसपे all these things are very important. Superior semicircular canal dehiscence, sudden sensory neural hearing loss, Meniere's disease, 1, 2, 3. Seum squamous I'm not saying because seum squamous is most important. वो तो important में छोड़ ले ही नहीं रहा हूँ. ठीक है. Superior semicircular canal dehiscence, sudden sensory neural hearing loss, Meniere's disease, otosclerosis. ठीक है. And apart from that, फिर ये वाला आपका cochlear implant, ABI, all these things are you should know. But ये all 4 can be asked in any way. So जब भी आप serum squamous से बोर हो जाते हैं, you get bored and you think that today is my otology day only. So please revise all these topics. है ना? Very important for your theory as well as practical session. So let's go ahead with this thing. A 45-year-old male patient presented to OPD with the complaints of impaired hearing in the right ear. ठीक है. Listening his own footfall with transient vertigo, disbalance while walking. This is his HRCT temporal bone scan. So answer is already given by Dr. Irfan. So answer is your superior semicircular canal dehiscence syndrome, or also called as third window syndrome. ठीक है. Now, what is the gold standard investigation for identification of this case?
HRCT, sir.
They have already given it. हाँ, बोलो कुछ कह रहे हैं आप? Any difference from HRCT TB? All of us agree?
VMP.
VAMP. Exactly. VAMP is also given. Where VAMP is both of them you can write, but gold standard as far as like these books are concerned, first answer should be your VAMP followed by HRCT TB. Both of them you can write. ठीक है. because there is confusion. Some places, some articles mention HRCT-DB, but some places mention WEMP also. Okay, so this is today's task. Please go through this again. SECD दोबारा से स्कॉट से पढ़ेंगे, कमिंग से देखेंगे, and on the next class we'll again discuss what will be the gold standard. One. Second question: what is the type of hearing loss? We all agree it is conductive hearing loss. Okay. Now third question जो आपका आ गया, what is the vestibular function test diagnostic of this condition? So now the answer is clearly WEMP. Okay. ठीक है. And WEMP maybe we have to write the full form, and then we'll be discussing WEMP. We'll discuss both C-WEMP and O-WEMP accordingly. Now see, they have asked over here, what is the full form of Fiesta MRI? तो Fiesta MRI का full form याद कर लेना. सारे MRI के sequences are very important. ठीक है. We will be sharing PDF slowly so that you don't get bored on the first day itself. ठीक है. सारे like Fiesta MRI, Stir MRI, FIS MRI, सारे sections are very important. So this is basically fast
Estimating steady state acquisition.
fast aging, employing steady state acquisition. ठीक है. And name any two surgical approaches for this patient. One will be your Lorne-Barnett technique, occlusion technique. Answer is from Scott Brown. ठीक है. Round window occlusion technique using plugging, capping or resurfacing. ठीक है. So now with this background knowledge of superior semicircular canal dehiscence, I will request कल परसों जब आपको टाइम मिले, again open the chapter of this chapter and go through these things, and now go a single point wise question which have been asked. Now look for these questions in the answer, so you will feel and understand better. Now coming to the second last question of the day, what is field cancerization? It is very, very important topic. Okay, so they can even ask you, this was given by whom? This was given by Slaughter et al. Okay, please remember these things. There are certain concepts which are very important. So I'll explain it to you in a very easy language, and we'll send or discuss the PDF and the articles associated. जिनको ज़्यादा पढ़ना है सारे articles पढ़ लेना. But for answering, you should remember these two lines. First thing is that this was given by Slaughter et al., also called as Slaughter hypothesis. Now what does this say? ये बोलता है कि like the whole aerodigestive tract is exposed to the similar carcinogen. So there is a possibility that even after developing of one malignancy, that whole field is exposed to that carcinogen, and there is a chance of developing another kind of malignancy in the same field. Okay, so this is the mota gist of your field cancerization. So please remember it. This can be asked. Okay. Last question for the day. Expand DAOs and what are its uses in ENT? So,
Ultrasonic surgery.
Transoral endoscopic ultrasonic surgery. Yes. Transoral endoscopic ultrasonic surgery. Uses ENT. We know that tumors of oral cavity, oropharyngeal, supraglottic malignancy, all these things can be used. Exactly. Remember this setup. ठीक है. इस setup के अलावा what all questions can be there? One thing we saw instruments में. Today we saw stapes वाले. ठीक है. Few instruments we saw. Second thing which you should know is your retractors. जैसे यहाँ पे they are using FK retractor. Okay, so remember this image. There are multiple retractors. Slowly we'll read about them. So two things, and third thing over here, not related to DAOs itself, which is important to you, that will be your bronchoscopes, esophagoscope, and laryngoscope. There are many laryngoscopes which are important to you. We'll discuss it, namely esophagus-scope दो ही प्रकार के होते हैं, जैकलर और नीगफ टाइप. ब्रोंकोस्कोप में अलग से कुछ है नहीं, रिजिड और फ्लेक्सिबल टाइप है. So we'll keep on discussing slowly and steadily, but whenever you start reading your instruments, your revision should start from इस तरीके से। ये मत करना कि at your level nobody will ask you instrument for tonsillectomy, nobody will ask you what is Jobson horn probe, anterior nasal speculum, है ना, वो हो गया अभी, वो nobody will ask. So the problem is कि when we share the PDF, तो जो PDF में हम लोग को पढ़ाते हैं वो इस तरीके से होता है, they start with that routine basic and till the time these main instruments come, our attention span is already gone. Attention span is 40 minutes. 40 minutes के ऊपर जो बोलते हैं मैं पढ़ता रहता हूँ, that's very doubtful thing. Okay, so start with the most important thing first, revise it, and then go out to the lesser important parts. Okay, so I would like to take on anything from your side, any positive or negative comment, it's most welcome. And apart from this, we'll again meet on the supposedly what this August session I had to compress it so that we will be ordered to make up for the exam session. The people who are from the June wala batch जो है, please यार revise, keep on revising, don't forget it. The only problem we have is that we tend to forget it. You might have read it 10 number of times, but exam तक अगर revise नहीं करेंगे तो भूल जाएंगे. So please keep on revising. That's why it will be, these things will be a sort of revision for you people. And every evening we'll be discussing around 10 to 20 most important which are questions which have been asked multiple number of times, and again they have the possibility of being asked. So रात को तकरीबन 9-9:15 के आसपास please be around your mobile, hang around your mobile. We'll keep on discussing 2-3 answers, start questions from my side, and the routine PDF or routine questions uska screenshot we'll discuss. Okay, so if anything from your side, please drop me a message. Any plus, any minus, not an issue. Anything which you want to include in that thing, we will definitely go with that. And the good thing is that DNB has still not declared the dates for the practical exam. So what is being supposed is कि date तकरीबन 3 हफ्ते का time आना चाहिए, like from the date of declaration of result till the date of practical 3 to 4 weeks का time होता है. So expecting that everything goes on its track record, somewhere in the mid of September we should be having our exam, 1 or 2 weeks here and there, because DNB is known for its these kind of things. So we'll keep on discussing. Anything you want to add, please let me know. We'll discuss, we'll add these things accordingly in a simple language, in a OSCE based format, not in a Ratta file format, not in a PPT format. Chalo guys, see you again on next day. Bye, good night.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you very much, sir.